If you're a senior and you're looking to regain mobility after your knee surgery, this video is for you. Recovery from a knee operation can feel slow and frustrating, but the right exercises done consistently can make a massive difference in how well and how quickly you regain your mobility. The movements I'm going to show you are gentle, joint-friendly, and perfect for anybody who wants to walk better, feel steadier, and reduce stiffness. If you don't know who I am, my name is Marius Visser. I'm a biokineticist at the Namibia Oncology Center, and today I'm guiding you through 5 simple, safe, and effective exercises to help you rebuild your strength, stability, and confidence following your knee surgery, especially if you are over the age of 50. So these exercises might not be for everybody, so please check with your healthcare provider to make sure that you are ready and cleared for exercise. So let's just establish from the beginning you are now 2 weeks post-op, at least 2 weeks post-op, and you are now starting the rehabilitation process to actually help strengthen and mobilize your knee so that you can actually get stronger into the future. So we're going to start off with a very basic exercise, and that is a knee extension. And first of all, you are going to place a normal rolled up towel under your knee, nice and gently. Place it right there. And also, if you do feel that you have a lot of pain and swelling and you need to start doing your exercises, you could always use cold therapy. Maybe take an ice pack, maybe a packet of frozen vegetables, and just put it on your knee about for 10 or 15 minutes actually before you start with the exercises. That actually helps alleviate the swelling, minimize the pain a little bit so that you can get through your exercises, and then maybe if it's a little bit painful afterwards, you can just place the ice packs on top of the knee joint again after your rehab. So we're going to start with knee extensions, and what we're going to do first is we're going to now gently try and press the back of my knee into the towel without lifting the heel off the floor. So it's going to look something like this. I'm going to press down and my quad is going to get active straight away. As you can see the actual muscles showing there, and we're going to hold for 5 seconds. 4, 3, 2, 1, and relax slowly, and we're going to repeat that. And again, 5, 4, 3, 2, 1, slowly back, and again. So what we're trying to do is we're trying to initiate contraction, 3, 2, 1, following surgery, because any type of surgery, whether it is a trauma, you've had an accident, or it's surgery, it's still very traumatic for the nervous system, and your muscles are going to try and protect you. And 5, 4, 3, 2, 1, and relax. So we actually need to help restore good nervous system response, good neuromuscular response, to actually engage those muscles so that they start learning their function. All right, moving on to the next exercise. So you're going to repeat that 2 to 3 sets of 5 seconds each, and then move on to the next exercise. So the next exercise is quad contractions. So what we're going to be doing is we're going to be sitting in a nice upright position. And again, what you're going to be doing is, without the towel, you're now just going to contract the quad, hold for 5 to 10 seconds, 3, 4, 5, and relax. And this is also going to now help straighten that knee out and gain some strength back in those quads. 3, 2, 1, and relax. And again, 5, 4, 3. You can see I'm actually picking up my toe and my heel is lifting now slightly off the floor. 1, and relax. And let's go for one more. 5, 4, 3, 2, and 1, and relax. Also rest for approximately 30 seconds to 1 minute, depending on how you feel, and you can repeat this another 1 to 2 sets. Now let's move on to the next one, and that is called the straight leg raise. Now I'm going to keep this leg right here. And now, the first 2 exercises was all about learning how to initiate a contraction on the knee or around the knee to straighten the joint as much as possible. Now, this exercise is going to teach you now to keep that contraction while we're lifting up and putting it back down, and relax. It's very important to relax afterwards, otherwise you will fatigue too quickly and you might not get the prescribed reps. And we're going to try and go for 5 to 10 reps. So again, we're going to contract first, pull up the toe, and only lift approximately 1 foot off the floor and down. You don't have to hold it there for a specific count. You can just lift it up and slowly down. It's more important to control the movement nice and smooth up and nice and smooth down. And we're just going to do 5. And let's go. Breathe out, pull the belly button in, always keeping the core nice and tight, training yourself. And down, and relax. Let's go for one more. Up, contract, there, and down. Now it's very important that you look at the knee, that it doesn't bend while you're lifting it. It's called a quad lag. We do not want to get that quad lag. That means that there's still either pain present in the knee, or the quads are so weak that it's going to actually affect exercises later on. It means that the quad is actually switching off when it starts to move, and that's not ideal. So you always want to make sure you contract to the quad, and as soon as you lift, there's not allowed to be any bend in that position as you lift off. Okay, so even the slightest bend like that is telling us that this quad is not ready for movement yet. And then you need to go back to the first two exercises, which is the towel contraction, knee extension, and the quad set of contracting, holding it for a few seconds, maybe 10, and relax. So let's move on to the next one. So our next exercise, we're going to do a assisted leg press. And for that, we're going to need a towel. So I'm going to grab this towel, and you can use a bath towel. The longer, actually, the better, if you cannot get around that close around your foot. And we're going to place this towel around like that. And I'm actually going to assist bending my knee up to the point where you feel, okay, this is now the most I can bend. And then you're going to push the knee as far as you can, push and lock it out and bring it back. And you're using your arms as resistance. So this is now a leg press, and you decide how much pull you want to put on the towel. 2, and come back. Let's go for 3 more. And see, every time that you come back, you might be able to get a little bit further. And push. And breathe out. 3. And let's go for 2 more. Breathe in. And 4. That's it. And come back. You can also use a TheraBand, different thickness. And come back and relax. And that is called the assisted leg press. Let's move on to the next one. So the next exercise, we are going to focus on the range of motion of the knee, trying to get as much bend in your knee as possible, using the hamstrings actually to help. So from here, we're going to lie down, and we're going to keep the one leg straight. This one, we're going to place the foot flat, and from there, we're going to pull the heel back to the bum as far as you can until you feel the knee is now taut, doesn't want to move any further. And then I want you to press your heel into the ground and hold for 5 seconds. 4, 3, 2, 1. Relax, and we straighten it just a little bit, just up to there. And we're going to repeat. Now we draw that heel into the bum as close as we can get. As soon as it stops, because there's too much tightness, we hold and we press this heel down into the ground. And 5, 4, 3, 2, 1. And let's go for 3 more. And 5, 4, 3, 2, 1. You can actually go all the way straight if you want and come all the way in. That's up to you. And hold 5, 4, 3, 2, 1. And I'm taking it out. I'll take it all the way. And then come back and go to maximum. And you might feel that every time you come in, you might be going a little bit further every time, and push down. 5, 4, 3, 2, 1, and relax. So our next exercise, we're going to be getting down on our stomach. And from here, we're going to just rest our heads, either our head on our hands, or we can get a pillow and maybe keep the pillow just under us like this, so we're nice and comfortable. And from here, we are going to now, I'm going to put myself up like this, because I don't want to create a distortion in my microphone, but you would be lying completely flat. So from there, I'm going to pick up my heel, go back as far as I can, and then slowly and control down. Now again, you might only be able to get up to there. That's fine. Get up, hold it for 5 seconds, and down. In fact, you don't even have to hold it for 5 seconds. You just have to pull it up as far as you can, get a maximal contraction, because your hamstrings might cramp at this stage. That's why I want you to be very careful. Maybe just go for a second contraction at the top and then down. Let's go for 3 more. 3, 4, that's it, and slowly down. Also important to control. You don't want the leg to just fall down. You want to create a nice smooth contraction as far as you can. slowly down, and one more, and 5. Hold a few seconds, I can feel it burning, and relax. So those were 6 exercises, phase 2 exercises for your knee if you are at that stage where you are really still in the beginning. But let's say you are a little bit further ahead in the process, we can actually start you with a sit to stand. So for our sit to stand, very simple, we just grab ourselves a chair. You're going to move yourself to the edge of that chair, and then from there, all you have to do is to try and maintain the same weight distribution over both knees. Now again, coming back to our first few exercises, you first have to demonstrate that you can do those first 6 exercises with good form and technique, and also do the prescribed sets and reps before you can actually move on to this one. So again, we want to have either no pain or minimal pain. If you say minimal pain, we're looking at a 4 or below out of 10 on the pain score. So we're going to start with keeping our feet nice and shoulder width apart, leaning forward, crossing our arms, and up, and then slowly down. We want to do this eccentrically. You want to go down as slow as you can for 5 seconds, 3, 4, 5, and then sit down completely and rest a few seconds. So again, we're going to go, breathe in, and as we move forward, we breathe out as we stand, and then slowly down. 5 seconds, 5, 4, 3, 2, 1, and sit. And we repeat this 5 times, and push out, and then slowly down. 5, 4, 3, 2, 1, and let's do one more. And breathe out, and slowly down. And 5, 4, 3, 2, 1. You can even hover there for a bit. See how long you can hold it before you sit, and down, and relax. The longer you can hold that position just before you touch down on the chair, the better it is going to be for your overall strength development. The last exercise we're going to move on to is a calf stretch. We grab our chair, and all we do is we place the one leg behind, keeping this leg straight, locking the knee out as much as you can. If you can only get it to there, that's fine. Try and keep the heel down as much as possible. And we hold for 20 to 30 seconds per side. And after 30 seconds, we change, swap legs around, always maintain good position with this knee. Make sure that you are able to bend it slightly under weight before we can do this one. And hold for 30 seconds, and last 5, 4, 3, 2, 1, and relax. If you like this video, please hit the like button, hit the subscribe button, and leave a comment down below and tell me how your exercises are going. See you next time.